This morning, a new warning from the director of the CDC, saying in an interview with the Washington Post that there's a possibility next winter will actually be even more difficult than the one we just went through, citing concerns about the next wave of coronavirus being coupled with the seasonal flu. Dr. Birx asked about those comments during yesterday's task force briefing.
We're also hoping by that time that we have additional treatment options for people with COVID-19. I don't know if it will be worse. I think this has been pretty bad. When you see what has happened in New York, that was very bad.
It comes as the timeline for the disease is changing here in the U.S. Officials in Santa Clara County, California now say 2 residents there died of coronavirus in early and mid-February, weeks before the United States' first coronavirus-related death was reported. Those officials pointing out that the residents did not have any known travel history that would have exposed them to the virus and are presumed to have contracted it in the community. Meantime, as the FDA conducts treatment trials, a panel of doctors with the NIH is issuing a new warning about a drug touted repeatedly by President Trump, hydroxychloroquine.
What do you have to lose? They've been taking it for 40 years for malaria.
It comes as a small analysis among VA hospitals found a higher mortality rate among patients given hydroxychloroquine, as well as those who received the drug in combination with the antibiotic known as Z-Pak. Researchers involved say they did not find the drug to be effective, adding their analysis highlights the importance of waiting for ongoing controlled studies before widespread adoption of these drugs. And on the testing front, new details on an at-home nose swab kit from LabCorp. To qualify, you have to fill out a questionnaire on the company's website before a kit is overnighted to your home. That sample is sent to a lab with results in 1 to 2 days. For now, that test is focused on the healthcare workers and first responders.
I would expect over the next several weeks that it'll become more and more available to the general public, particularly those that have symptoms.
You know, a lot of focus right now, a lot of focus on reopening parts of the economy. The Justice Department says it's paying close attention. The Attorney General says some of these stay-at-home orders actually border on home arrest, which he says borders on whether it's constitutional or not. But he also says it would be justifiable in some cases, but not for the long term. The Attorney General watching all of this closely as well.